Two frightening cases caused police to confront people likely suffering from mental illness. First, you had this woman in Pasadena, charged with stabbing her grandmother. Then days later, a Glen Burnie man threatens police with a rifle.
They spoke to the suspect, and she said that she stabbed her grandmother because she was trying to cut the demons out of her. The male made statements that voices in his head were telling him to kill people, and the voices wanted him to shoot at the police.
Police and prisons are now the front lines for treating mental illnesses in the U.S. And tonight we're digging deeper into why this problem evolved and how we can fix it. Beth McGinty, an assistant professor at the Johns Hopkins Bloomberg School of Public Health, here to talk with us about this. This is your life's work, Beth. I know you guys have been researching this for years. How did we get to this point?
It's a great question. This started decades ago in the 1950s and 60s when there was a policy decision to dismantle long-term psychiatric care, often called asylums, for people with serious mental illnesses like schizophrenia and bipolar disorder. And the reason that that decision was made, well, there were really two reasons. One is that these were pretty horrible places to live. Conditions were terrible. Another reason is that we had the development of new treatments, new antipsychotic medications at that time, which can help control the symptoms of serious mental illnesses.
So I guess how do we fix this problem now? Because again, you're having police officers responding to calls and basically they're becoming social workers or psychiatrists.
So unfortunately what has happened is that we dismantled long-term care for people with serious mental illness without building an adequate community mental health system to meet these people's needs, which are intensive. People need lots of services to live successfully in the community, which they absolutely can do. But they need help with housing, help with employment, lots of intensive treatment. And that system in many communities just doesn't exist, which leads to unemployment and homelessness and contact with the police, and sometimes, as in the examples we just heard, terrible acts of violence.
So I guess how do we help the police officers, or are we talking about additional resources, funding? I guess how do we get to the root of this problem?
So I think you need a multi-pronged approach. We certainly need additional resources devoted, as I said, to the community mental health system so that there are effective services that we know work that can help people stay off the streets and keep them uninvolved in crime. There are other resources as well, crisis intervention teams, which partner law enforcement with mental health clinicians that have been shown to help de-escalate situations when police have to encounter someone with serious mental illness, can also be a really big help.
So are the officers getting the training they need for these types of situations?
Unfortunately, in many jurisdictions, no. I mean, this has not historically been part of police officers' roles. Increasingly, because this is such a problem, we are having more and more training. Baltimore is starting to do crisis intervention team training, for example. That's happening increasingly in other jurisdictions, but we've still got a long way to go.
It seems like it's actually getting worse.
As we see, defunding of mental health services. Unfortunately, budgets are tight in a lot of places. Mental health services are often some of the first to get cut. You've got more people as a result who, for example, are homeless. And homelessness is a huge risk factor for running into the police due to minor crimes, nuisance crimes, trespassing, as well as violence.
So we heard a lot this week about the 21st Century Cares or Cures Act. The president signed it. How might this help in the situation?
So several ways. So this act authorizes new funding for some of the services that I'm talking about, things like supported housing, supported employment that might help people with serious mental illness stay off the street and stay out of contact with police. Better for everybody in that scenario. It also includes funding for the crisis intervention teams that I alluded to, which might help give police some support, for example, by embedding a mental health counselor in a specially trained team of law enforcement officers to respond to calls involving a person with mental illness.
Like a special unit that would go out with police officers.
Yes, exactly.
Beth McGinty, keep up the great work.